Hello there, Pattaya. It's Dr. Ian, and I'm at the Bangkok Hospital, Pattaya. My guest today is Dr. Puttachart. Now, Dr. Puttachart is an allergist, one of the very important specialties in medicine. Welcome to the program, Dr. Puttachart.
Hello, Dr. Ian. I'm Dr. Puttachart.
Now, when we talk about allergies, how do they present? Do they present all the same way, or do they present in different ways?
The allergies is many varieties of the presentation. But if we try to cover about 80% of patients with allergies, we have to talk about three things. It's a big three of the allergies. First one is atopic dermatitis. We know it in eczema.
Right.
They're coming with the itchy and rash over the skin off and on. And the second one is allergic rhinitis. They're coming with the blocked nose, runny nose, itchy nose, and sneezing. And the last one is asthma. They came with wheezing or chronic cough. These three things is cover about 80%. The rest is allergic to cow's milk, allergic to seafood, drug allergies, and allergic to some cosmetic or chemicals.
Are there any common trigger factors in allergy?
The trigger factors of the allergies is depend on the things that the patient allergic to. But mostly, if we talk about the allergies, the trigger factors we separate in specific triggers and non-specific triggers.
Right.
The specific triggers is like if you're allergic to seafood, to shrimp, to crabs, you're allergic to this. But if you have the allergic rhinitis, asthma, the most common thing for you or maybe another patient of the world is house dust mite.
Is there any way to get rid of the house dust mite?
We avoid it to expose to house dust mite. We use a special mattress or bed cover. We use some chemical to kill it. But anyway, after you do it for a long time, it still come back in your bed.
Right. For people who have allergies, have come up with a specific allergy, are there any tests that can be done?
The job for the allergist, the first one is to define that what do you allergic to?
Having found what the person is allergic to, what treatment can be done for these people?
All allergic diseases, we can do the treatment in 4 steps. The first one is very important. It's avoidance. Before you avoid something, you have to know that what you're allergic to.
Yes.
That is the last question. The second one is the medicine. The medicine is include oral medicine, nasal spray, and inhalant. It can control your disease, just control it. Cannot be cured. After you stop the medicine, it will come back.
Right.
And the third one we call is immunotherapy or immunovaccine. We do it in some specific patient. Like if you're allergic to house dust mite, we use a house dust mite injection, do the vaccine to produce your immune. After finish the course, the success rate is about 70% to 80% success. And the last step is in a general advice, exercise, food, and how you sleep.
Right. Dr. Puttachart, thank you very much indeed for talking to us about allergies. As you say, it's a very complex kind of conditions, It's not one separate thing. But if any of you out there feel that you have an allergy, or feel that your runny nose or whatever is caused by an allergy, then please consult our allergist. Again, thank you very much, Dr. Puttachat.
Welcome.